Hello, everyone, and welcome to Children's Healthcare Canada's Fireside Chat with Nora Fayed and Rachel Martins. And we're exploring today how Canadian families are doing with home care and medical technology for children with complexity during COVID-19. I'm Paula Robeson, your host for the next hour. We hope this session will be as interactive as the GoToMeeting technology will allow. If you wish to ask a question of Nora or Rachel, just type the question in the chat box and we will indicate when it's your turn to ask. Then unmute your mic to ask away. Alternatively, if you don't want to ask over the line, you may type your questions into the chat box at any time and we'll read them out as well. We're delighted to be joined today by Dr. Nora Fayed and Rachel Martins. Dr. Fayed is an assistant professor of occupational therapy in the School of Rehabilitation at Queen's University, and her clinical work and research focuses on the quality of life and health and rehabilitation services for children with medical complexity and other health conditions. Rachel Martins is the parent knowledge broker on Dr. Fayed's research team, and Rachel is a mom of a young man with a very rare chromosomal disorder with a long history within the healthcare system. She's developed a passion for advocacy and child health policy, knowing that family partnerships can play an integral role in the healthcare improvement. Nora and Rachel are involved in a new COVID-related study monitoring your child's access to med tech, focused on surveillance and monitoring of children's access to supplies and healthcare for their medically technology-dependent children at home. It's my pleasure to pass the mic to Nora.
Thank you for the wonderful introduction. Is everyone hearing me okay? Unless I get some head shakes or some chat things popping up. When we started putting this study together, following the announcement of kind of societal lockdown and the arrival of COVID in Canada, we were doing other research, and so I would love to be able to just kind of jump right into this study and talk about what we're doing, but I don't think that'll be easy to do without providing everyone a little bit of background about myself. Maybe, and Rachel will do the same for herself, and the research that has brought us to this point, in addition to COVID. So as Paula mentioned, I'm based out of Queen's University in Kingston, Ontario. My background is occupational therapy, and my research is very focused on evaluating children's services, specifically for kids with disabilities or chronic diseases, with the lens of how do we evaluate those services to promote good day-to-day life. So that is a little bit about me. I'll talk more in detail about my background as we go, but I think I'll just pass the mic over to Rachel to introduce herself as well.
Good morning, everyone. As mentioned, my name is Rachel Martins. I am mom to an almost 14-year-old young man who is quite medically complex. We have collected quite the wide variety of medical technology as time has passed, to a point where we have as we can see, we're sitting in my bedroom here, and I have a lovely med cart full of pretty much anything that can be plugged in, all ready to go at a moment's notice. One of the reasons that brings me here today is that I am a partner on Nora's project, obviously having lived experience. I also work in the field of family engagement in childhood disability research as well too. So I do have a lot of pan-Canadian sort of connections to families across Canada. And today I'm here to essentially kind of help to host the conversation a little bit with the Q&As and stuff like that. I have a few questions to ask Nora after she fills in a little bit more about what the project is about. On to you, Nora.
Okay, wonderful. So I have slides, despite the fact that this is the fireside chat. Really, they're just cues to help me tell a story. If people have questions, or anything of that nature, feel free to type them in, and I think I'll try and build in some check-in points as well. Right, let's see if I can advance here. I'm not being successful. Oh, there we go. here we are. Okay. So I thought I would start by saying that I am a member of a team of other researchers and service providers, all of whom are quite dedicated to studying and providing service for children with medical complexity. And until now, we have been very focused on evaluating the delivery of coordinated care. And that's because previous research by other providers and researchers has shown that coordinated care is really the first step in improving care for children with medical complexity. And in Ontario, we were so lucky that we have the Provincial Council of Child and Maternal and Child Health that has a special focus and interest on children with medical complexity and have introduced a new pilot intervention of coordinated care across the province. We're also so fortunate to have service leaders, service provider leaders, physician leaders, complex care program leaders who want to deliver this intervention, but also want to evaluate it as robustly as possible. And so when this started to be rolled out, I was approached by both the Provincial Council and colleague members of complex care programs around measuring the family experience as part of this evaluation. So the evaluation was always going to be assessed based on health utilization, whether it made healthcare more efficient for families, and that's something that policymakers really need to know. But I think policymakers also really needed to know how families perceive the intervention. So that was essentially my job, was to include measurements that would assess how families thought about this. Okay, and like I mentioned, I was just one of a large team, and the people who are on this slide are just a small sampling of the people, the different institutions who are leading rolling out these interventions. So again, my involvement on the team, the reason I was asked was because I have a research background in measurement sciences, and I apply most of that methodological expertise in measuring children's quality of life, especially children with disabilities and chronic diseases. And that experience came from working at a research branch of the World Health Organization, as well as the University Health Network in Toronto, and completing my PhD in rehabilitation science and again, a fellowship in pediatrics at McMaster University. So lots of training dedicated to this one particular topic about, you know, how are we going to measure things that are really important to people, but that aren't easy to observe. So that was something important to evaluating how families feel about complex care. But it was also really wonderful for me to join this team from the lens of an occupational therapist. So my clinical experience was mostly based in outpatient feeding. So I did get to see a lot of the families who are in this group in my clinical practice. But I also worked as a caregiver for many years as a PSW prior to that. And so I take those two bits of experience with me when I am thinking of the entire measurement process. And I'm an educator too. So I really think about how do we train future clinicians to think about being really client-centered, really family-centered when they're doing their work. And I try and measure in a family-centered way, thinking about what measures families are really interested in. And I was at a meeting, a network meeting a little while ago, where there were families there and researchers there and doctors there, and we were at a round table, and someone said something that really resonated with a parent. parent of a child with medical complexity said, you know what, if you want to do research with families, you need to go where they go. You need to be where they are. And that really stuck with me. And since then, I've been trying to get involved with watching and being and having discussions with families online. So we created a Facebook page called Everything That Counts. And the idea behind that is if it's important, we should be counting it, we should be measuring it, we should be representing it in research. And whenever we finish a study, we always try and put the results up on that Facebook page. And so if you're joining us here today, I encourage you to check us out on Facebook. So our page is ET Counts, Everything That Counts. Also, I've recently joined Twitter as a couple of months ago, and that has been an interesting experience as well. I've met a whole new group of families on Twitter, and I've written my first blog post following the pandemic. We all have our concerns about the pandemic, and I couldn't get mine off my chest fast enough, so I wrote a blog post. And that's also available. Okay, let's see if we can. So let's get back to that evaluation of care that we were doing in Ontario. They said, let's get a quality of life measure. Let's get some measures in there that represent families. And I said, well, before I tell you what to measure, why don't we ask the families what is the good criteria for success? If this intervention goes well, how will we know from their point of view? And so we did a really quick survey of families online, and the Provincial Council of Child and Maternal Health really helped us with this. We asked providers also about what were the most important outcomes. We asked them about something like 65 potential outcomes and went through a really rigorous survey and analysis process. And what we found were that there were like 3 very, very important categories of good outcome for evaluating coordinated care. And that had to do with the experience of care and some outcomes relating to the child and the family. In terms of experiences of care, families needed to see outpatient care that was really comprehensive, that met all their needs. They wanted the care to be family-centered. They wanted the care planning tools to actually be useful, but one of the really interesting ones that I like to see was that they want to see their care providers, all their different specialists, all their different providers talk amongst themselves and coordinate care better because of just the amount of coordination they had to do on their own that they felt providers could do to support them. In terms of child outcomes, families wanted to see that their children's pain was assessed and monitored and treated, that their emotional health was part of the discussion and that was improving as a result of care when possible. The eating, feeding, swallowing of their children for kids who are taking food by mouth, or even for parents who are doing enteral feeding via G-tubes or other forms of feeding tubes. They really needed care providers to step up in that regard and do a good job of delivering care. Parents needed to also have a good experience of their child's medical technology. So I don't need to tell families, because families are the ones that tell me that they are essentially like care providers in their own home, and they have to troubleshoot through all this medical technology. Sometimes it's feeding tubes, sometimes it's ventilators, could be central lines. There's a wide array of medical tech out there that families have to learn to use and manage and troubleshoot through all the time, and they want a better quality of life for their kids. I'm just going to highlight one of my favorite family outcomes was the effect on family finances. And Mila Moretti on our team is a health economist who is not just looking at the cost of the intervention from the government perspective, but at the same time quantifying the cost to individual families. And it's really, really in depth. And I'm so proud to be part of a team that's going to be evaluating a clinical trial of care or pragmatic trial of care based on these things. So the results of the trial will be extremely important for health system improvement, both in Ontario, but we plan on sharing our results around the country as other complex care programs are coming online. The results will be not just accountable to families, but it'll be for outcomes that they really value. We'll be able to say, did the intervention improve quality of life? Did it improve pain? Did it improve care coordination? And we'll also help clinicians identify the areas in which they need to improve and where they're doing well. So I'm really proud to be part of that team. And I would love to share those results with you right now. They're expected in late 2021. And I can't, as soon as we have them, I know there'll be many stakeholders waiting to see the results. It's truly going to be a wonderful thing to be able to share that. I think our trial is unique. There have been other trials of care for complex care families, but none that have this level of family involvement in deciding what the criteria for success are going to be. I think I mentioned a couple of outcomes earlier that, well, actually, maybe before we move on, I should, maybe let's check in at this point. Does anyone have any questions or comments about that?
In the chat box so far, if you have a question or comment, just let us know in the chat box and we'll get you to unmute your line.
Okay, I'm going to keep going and then we can just kind of talk as a group. There were a couple of outcomes, as I mentioned, as part of that family engagement that we did, checking in with families that really needed to be measured, and there were no measurement tools for them. And that two things that we really needed to be assessing as part of the trial that we could not assess were, one, how people were doing with managing their child's medical technology. And the second one is how they were doing with feeding their child, whether it was feeding them by mouth or through feeding tubes. So luckily for me, I'm a measurement scientist and was able to kind of hop on board and start solving that problem or contribute to solving that problem. Let me just, come on, little arrow guys. I'm having some difficulty advancing in my slides. And if that continues, what I'm going to do is I'm going to try and escape. There we go. Usually when you're developing a measure, experts get around the table and they say, these are the things that need to go in the questions. But we decided to do this a little bit differently. We decided to check with the families what does good outcome look like. Tell us about a good day managing your child's medical technology. Tell us when it's going well. Tell us when feeding's going well, when it's going poorly. And we did tons of interviews with families. And the interesting thing about the way we did this is we had OT students, occupational therapy students doing the interviews, but we also had moms doing the interviews with other moms. So we hired moms as part of the research teams, medical moms, and we trained them as qualitative interviewers. They filled in confidentiality agreements. They were professional research assistants, but they were also medical moms, and they did the interviews too. And we feel like that made the information that really enriched the information that we received in order to create these measures. Okay, so we were creating those measures. We had a good amount of people filling in the survey, and things were going quite well. And I'm pleased to say we have enough data to publish those measures soon, and I hope to be writing up those manuscripts and putting them in the public domain and publish them this summer. Once they're published and available, care providers will be able to use them to assess care. So any families who filled in those surveys, that's what's happening with them, and we're really excited and thankful that you contributed to that research. And as soon as it's available, it'll be up on Everything That Counts, and in the peer-reviewed literature. Takes a little longer. So then the arrival of the COVID-19 pandemic came, and I thought to myself, okay, how are our families doing? So I'm really lucky to be part of a Facebook group called, Rachel, what's the name of our Facebook group? Are you there?
Oh, yep, I am, yeah. So through Kids Brain Health Network, we started a project 5 years ago called Parents Partnering in Research. And it was a paper essentially written on the idea that if you got families together with researchers in a social space like this and just talked about childhood disability and things like that, you would have the potential to generate really great research projects. You would have easy access to partnerships with family members and things like that. And we learn a lot more about each other as well too, where I have an hour in clinic and I might not be able to capture all the nuances of what's going on in my life. We begin to understand each other a little bit more when we have that extended opportunity to get to know each other better. And so that's how Nora and I actually got to connect. And I should mention as well too, I'd be happy to get that information too, should you wish to join the group as well too, either parent or researcher.
Yeah, so I was able to connect to families through that group and through Rachel, and just do a little quick connection with families. How are you feeling? What are your major concerns? What is really worrying with the arrival of this pandemic? And I did hear a lot of fears come forward. So here's some of the main concerns that I heard about online through engaging with that group, through engaging with families on Twitter. I heard questions about, our kids vulnerable, and do we need to protect them in a different way than other children? Because our kids are vulnerable to going to the hospital or getting very sick from just a cold on any given day, and that's without COVID. Families wanted to know if their kids were going to have the same rights to care, but also if they were going to be able to stay with their children when they were receiving care, especially for the families of who were caregivers of a young adult. There was a lot of concerns about home care and people coming into the home to provide care. People were worried about the medical supply chain. So think back to, I know late March, early April seems like years ago at this point, but I do recall we were really worried about medical supplies and in particular personal protective equipment, which continues to be an ongoing concern for families. But we really had no idea. So families who were who need replacement parts and supplies, were they going to be able to access them? Were the supplies going to be there? Were they going to have access to their specialists, or were the specialists going to be so busy managing this pandemic in the hospital that you wouldn't be able to access your provider unless you went to the hospital? And then just having enough support when you are socially isolated and physically isolated on lockdown and not having your typical supports in place, and what the cost of that would be to caregivers mentally and physically. So I have to say that we launched a study that really looked at directly being able to track how people are doing with the bottom four, those ones that are lit up in blue there. Is home care safe? I think families have a lot of concerns about that, and different families have been able to make different arrangements and have different levels of comfort and procedures in place in order to answer that question for themselves. But I do think we're very concerned about getting the data that will allow us to answer this question over time. We did have reality constraints, though, like everybody. The very first one is that caregivers, we knew they were already stretched before the pandemic, but with the arrival of the pandemic, it was amplified substantially. And so we needed to create a survey that was easy to access and very fast to complete. But the problem from a research perspective is that if you make it fast, sometimes you lose information. So I had to work very hard as a measurement scientist to think very carefully with families about what was the most important thing to measure over time and why, so we could measure it quickly. So I'll just show you a little video, hopefully it works, that kind of summarizes what we're trying to do. So that's just an example of how we try to reach out to people quickly and in forms that are accessible, where it's not too much burden to engage. Just a quick note, all of our videos are done by the same software, and they all have that music. So if you click on a different video and they have that music as well, you might be clicking on a new one, but if you get that song in your head through engaging with us, I apologize in advance. Okay, so what do the questions look like? I thought I would give people a quick survey. The first time you log in, it's going to ask you questions about you and your child. That is the longest form that you have to fill in online, but it's really, once you've done it, you don't have to do it again. But there's an example of some of the questions. Then it's going to ask you how you're doing with home care. This is a pretty short questionnaire. It asks you about how much home care you're getting, if it's increased or decreased, but also if there's been any changes to your home care during the pandemic or in the period of time that they ask you about, if it was your decision or not. That's one of the things we really want to know is, are the changes that you're making because you want to make them or because someone else is making them for you. So that one only takes a few minutes to do, and that one they'll send you a little reminder every month to fill that in. You can do it on your smartphone or on your computer, whatever is easier for you. And then it'll ask you about how you're accessing medical supplies and care for your medical supplies. It'll ask about virtual technology or virtual care if you're having a problem with your child's medical technology. It'll ask you about if you can access your supplies. I think there's about 18 questions in there, but it goes pretty quickly. And then the last thing it'll ask you about, there's about 5 questions about how you feel you're doing with your physical and mental health, and that's a really quick survey. So the repeated monthly surveys would cue you to do those all the way to the end of December. So where are we at in the study? We launched it in mid-April, and so we've been live for more than 30 days now. And the target number of families we have is actually really ambitious. We know that families of children with medical complexity are a really small group, important group, but small group. So it's not easy to get lots and lots of families. You have to really look far and wide. But so far, we've been pretty successful in that we have enrolled almost close to 50 families at this point, but we're looking to get more than 120, between 120 and 130, and anyone in Canada can join. And our goal is to reach that like light blue line there as soon as we possibly can. And why are we so interested? So that's where we're at right now. We're at close to 50. So why does it matter how many people? Like, why can't we just say, okay, well, you've got almost, let's say you get 50 families. Why can't that be enough? Well, it is, and it is useful. But I do want to point out that the more families we get closer to our target, the more the more questions we'll be able to answer, the more confident we'll be in the data, and the more I think the data will be well received. Where did that number come from of trying to get to over 100, between 120 and 130? The number came from how many children and families we were able to enroll as part of our Ontario evaluation. So if we get a comparable number of people, we know they're not going to be the same types of people, but it'll help us interpret what types of families we're getting. Are we getting families who live far away from academic medical centers? Are we getting families who live close by? Are we getting families of 2-parent homes or single-parent homes? Like, maybe we'll be able to really represent families across Canada quite well with this. So let me just present a hypothetical data scenario to you as something we could do with this data. So for example, let's just say, I just want to be really clear, this data is not real data at this point. But let's say we've started collecting data and we've got families enrolled in the study, and then the light blue line up there is the amount of home care people were getting before the pandemic. So let's say we figure out how much home care you were getting before the pandemic, and then we can start looking at what you're getting month to month during the pandemic. So let's say at about in June, families are getting about 75% of the amount of home caregiving that they were getting prior to the pandemic. Well, that sounds pretty good, but let's just say something happens, and sorry about that. A great policy change has been announced with regards to home care in July or August, and it makes families feel really confident about home care providers and services, and provider capacity ramps up, or some kind of policy change. And we'll be able to show that it actually made a difference to families' choices or not. The problem is we can't do this looking backwards. So if there's a policy change and it affects how families feel about their home care, we won't be able to ask them as well, how did you feel about your home care back in April? The data won't be as robust, as believable, as clear and evidence-based as if we had asked them ahead of time. So that's just one example of the things we could do with the data. But for anything that relates to your access to your child's medical technology, how you're doing with home care versus how much home care you actually receive, all of those kinds of things, will really be able to track that. So what do we know so far from the baseline data? I have to say the baseline data is not really meaningful at one time point on its own. So, but this is what I can share. I can share that every 100 times a person watches a video, it might be this, you know, or maybe not a person watching a video, but every 100 times a video is watched, about 5 people join the study. So that's actually excellent. It sounds really low, but in research, that's pretty good for internet-based research. I can tell you that there are families who are making changes to the way they think about home care and their home care decisions, but there are families that are not. There's a lot of diversity of how people are responding to the pandemic. And some people felt that their overall mental health had started to suffer, but other people felt that they were managing. When I say their overall mental health, I mean like the big things, how depressed they are, not necessarily how irritable or tired. We're getting pretty clear signals about how tired or irritable or how anxious families are. But again, we have to look at these things over time. And some people reported that they were getting virtual care that they had never had before, and that was good. But the bottom line of what we're getting from the baseline is that people's experiences are really diverse, and that means to me that there's no one way to respond to what's happening for your individual family in the context of this pandemic. Whatever you have done or whatever you've decided to do, there's another family out there that has decided to do something similar. You're not alone. So now I'd like to kind of open up the discussion about what the families want to see from this data, how you think we could use this information to improve care in the short term or the long term after we collect it. How can we make sure that we prepare the system better for our families if there's ever a future pandemic? Those are kind of the check-in points that I was hoping to hear from families about.